Dr. Bonjibola Apiri, who is a consultant psychiatrist and mental health advocate. Thanks for joining us this
Thank you for having me. I think that for people to understand what trauma is, it's important to understand that trauma is a response. And before you get a response, you have a stimulus. Trauma is an emotional, psychological, physical response to a stressful or significantly life-threatening event. And so you say that trauma has happened, or there's been a traumatic life experience if an individual has an experience that is sudden, uncertain, distressing, and threatening to not just their physical, their mental, and their social, psychological well-being as well.
The death of a spouse could be traumatic to one.
Definitely. And so different things connote trauma for different people at different ages, different walks of life. Even in our jobs, we experience trauma. I mean, the news that sometimes people, cast, the jobs that I do, listen to people's, real life experiences, stories, experiences such as childbirth, even life events that we would otherwise see as happy, marriage, childbirth, the loss of a loved one.
Marriage
Again,
could be
yes,
traumatic?
of course it could be traumatic, because you could then come, to the reality of something you weren't expecting or something that you can't deal with. Remember, again, that it's a response to something that you find significantly stressful, distressing, and that threatens your physical and emotional well-being. The kind of trauma that we have in the space or the world of healthcare professionals is that which is referred to as secondary or vicarious trauma, where you are traumatized, listening to, watching, and engaging in some of the day-to-day, experiences. So dealing with patients in the emergency, watching patients die, having to tell people they've lost loved ones, or listening to even the traumatic experiences that are shared with you day in, day out. It's pertinent to state at this point that not everyone who faces a traumatic life event becomes traumatized. People will react their normal responses to trauma or to stressful life events. Okay. Normal responses which can be cognitive, affecting the mind, emotional, affecting the emotions, or physical, affecting the body. And so people will react differently. Some of these responses are normal. Like, if, for instance, I heard of the loss of a patient, if I lose sleep for a few days, it's normal. But after a while, when it's becoming a week, 2 weeks, it's interfering with my mood, my emotions, my perception, my behavior, my productivity, my efficiency at the work front, my interactions with other people. Then we can then say that it's becoming distressing to the individual. So there are normal responses to trauma or stressful life events in general. However, when their intensity, frequency starts to increase and they cause significant distress to the individual, then we say that it's become a problem. The first thing to do is to introspect and understand that we've all been traumatized, and possibly that we all still undergo trauma every day. And so that awareness and that acceptance and that willingness to want to seek help for that which has gone wrong is the first step to, dealing with the trauma. After accepting and being willing, you can then find a therapist who, I dare say, is better skilled in dealing with traumatic experiences to walk you through the journey. Trauma has many facets and can show up in different ways, even unconsciously many times. Sometimes the trauma that our parents experienced may even show up in our own lives in ways that they don't realize because they didn't resolve their own traumas. And so it's not enough to accept, it's not enough to identify, but to walk with a committed and trained individual who is able to show you that this is likely to be trauma. I'll give a reference to a book, Emotional Inheritance. And what that book basically talks about is how it is that we inherit trauma from our parents, even unconsciously. There's a story of a young girl in the book, Lara, who was 10 at the time she started seeing a therapist. And when she started seeing a therapist, it was that her grandmother thought that her brother was sexually assaulting her. She had no evidence, but she strongly believed that her brother was sexually assaulting her. Over years, the girl stopped therapy and then eventually came back to therapy herself. By the time she came back to therapy, it was revealed that the parents had gotten divorced because of the stress and strain that the grandmother repeatedly kept saying that her brother had sexually abused her. It was only when Lara, the girl in question, went to live with her grandmother, found out that what had happened was that her grandmother had in fact had an incestuous relationship with her own brother while growing up.
Oh, God.
So it wasn't that Lara and her own brother had anything, but because the grandma did not heal from her own trauma, she projected her fears, insecurities into the life of her own grandchild. And unfortunately ruined her daughter's marriage and somehow her grandchild's life. So sometimes in the upbringing, the things parents say to children, the expectations that parents have of children, the challenges and obstacles that is sometimes throw their way, unhealed trauma in parents can show up in the lives of their own children or even grandchildren. We don't want to accept reality as it is. We have a problem accepting reality because sometimes reality is too distressing to accept. And so people would rather push away what they don't want to accept. Pushing it away, however, allows it to transform, become, more monstrous. One day it will show up. Okay. And so regardless of how difficult it may seem, I would encourage that as much as possible that we face and confront our fears and our traumas, especially with sexual trauma, is that it is lined under so many layers that make you think that you've forgotten. Sometimes it may be how someone touched you or what someone says to you that wakes it up at the end of the day. It is difficult, especially when that trauma happened not just once. Again, it can be once, depending on the age, who it was that enacted the trauma, where it was that it happened, who you spoke to, and whether or not they believed you when you said, what you said. Or did it happen a lot of times? Processed trauma. Sexual trauma almost always happens from trusted individuals, people that people know. And that makes it more difficult to, deal with and more difficult to even want to relieve or heal from. So many things would affect whether or not an individual wants to face their trauma. But no matter how cleverly we think that we have shut it out, trauma will always show up. You may find that people who have been traumatized are more likely to be loners, socially isolated, or they are described as promiscuous, going above and beyond, overcompensating because they couldn't control what happened to them. We like to look at wellness in what we call the 8 pillars of wellness. And so whatever problem an individual brings to me in a therapy room, I would be able to pin it in one area of the 8 pillars. Either it be physical, financial, spiritual, social, environmental, intellectual, you'd be able to piece it somewhere there. I don't know what research that states, but I know that moving is a significant life event, not just on an adult. I mean, you leave everything, you leave the comfort of everything that you're used to. You leave life as you knew it, and you're moving somewhere else. You're moving, you're moving your mind. You're moving physical things. You lose things. When I move, I don't like it because there are boxes that for years I will not touch.
True. Exactly,
and I would just leave the room as it is. Sometimes, thinking about who to call, how to call, what to move, it can be traumatic. It is a significant life event. So, and just because it doesn't impact one does not mean, it cannot impact someone else. Accept that there's something going on. Accept that you don't have to wait until that child is exhibiting behavioral problems. If a child is telling you, I'm having nightmares, or you've noticed that child is becoming withdrawn, isolated, not doing as well as they did in school before, regressing, perhaps bedwetting when they had reached an age where, they had achieved control, there's a difference between the child you knew and the child you currently have. Seek therapy. They're child therapists, and they're child therapists who would help the child deal with whatever traumatic experience that the child is going through.
Mental health issues. How serious is it in our world, especially in Nigeria?
Well, back burner issue for a long time, but now we're seeing it everywhere, every day, in almost everything that people do. They're very serious.